Hello, I'm Dr. Sindhu, an operating doctor here today. May I confirm your good name and age, please? Nice to meet you, Mr. Zishan. May I know what brings you here today? Okay. Anything else? Okay. Okay, I'm really sorry to hear about it, Mr. Zishan, and I appreciate that you are concerned about your health. Before I come to the conclusion, I'll ask you a few questions. Is it okay with you? So, Mr. Zishan, you have told me that you are experiencing certain symptoms after prescription of glimepiride 1 mg once, and you are afraid that your brain may be damaged, and your sugar on two occasions was less than 70 milligram per deciliter. Is there anything else you want to add? Okay, can I ask you a few more questions? Can you tell me, did you experience any such symptom in the past? Okay, and do you have high blood pressure as well? Okay. Okay, Mr. Zishan, I'll ask you a few personal questions. Is it okay with you? Are you a smoker? Okay. Have you ever tried to quit smoking? Okay, we'll talk this in the next appointment. And do you drink? Okay. Okay. So, do you have any heart problem? Any major medical problem in immediate family member? Okay. I'm really sorry to hear about it. Okay, so Mr. Zishan, can you tell me if you're taking any medicine regularly, over the counter or prescribed by a doctor? Okay, any other medicine? Do you have any allergies? Okay. Okay, so Mr. Zishan, how this problem has affected your life? Okay, and what do you think you are suffering from? Can you tell me what worries you the most? Yes, I'm sorry to hear it, and yeah, and I appreciate that you came here for your health. Okay, so Mr. Zishan, you have told me that you have high blood sugar, you have blood pressure, for which you are taking glimepiride and atenolol, and you are a heavy smoker and drinker, and you have a strong family history of diabetes, hypertension and heart problem, and you are having some symptoms due to which you think your brain is damaged. Is this all, or you want to add something else? Okay, and so Mr. Zishan, have you ever been to an investigation recently? Okay. Okay, so Mr. Zishan, I'll ask for you following test. Okay, it is HbA1c and blood sugar fasting 2 hours after meal, complete lipid profile and complete renal profile. Is it okay with you? Can you go for these labs? Okay. So, well, Mr. Zishan, let's come to the management. What I have gathered from your information, you have started atenolol recently, and you have shared information, and your blood report shows that you are having a condition, what we call in a medical term is hypoglycemia. And do you know anything about hypoglycemia? Should I tell you? Okay, so Mr. Zishan, sometimes if a diabetic skip his meal or do excessive exercise or take more medicine or insulin for his high blood sugar, then his blood sugar can drop to dangerous levels and cause certain symptoms like you are having. Okay, is it clear till now? Should I repeat it again? Okay, and so Mr. Zishan, it is my considered opinion that most probably Glimepiride 1 mg once a day is responsible for your symptoms. Okay, and I'll offer you to change this medicine with metformin 500 mg twice a day with every lunch and dinner. Is it okay with you? And Mr. Zishan, I'll also offer you to change your medicine for your high blood pressure, beta blocker medicine to ACE inhibitor group like Ramipril 2.5 mg a day. Okay, because a beta blocker decrease awareness of low sugar levels and it has to be tapered on in 1 month's time. Okay, and please please take immediately some sweet things like sugar, honey, and sweet biscuits if you experience any of such symptoms you described. Okay, is everything clear till now? And Mr. Zishan, I'll strongly encourage you to please keep wearing a Medi Alert bracelet or necklace describing you as a diabetic, and so that in emergency situation your family or colleagues at work could give you glucagon injection, which can be life-saving. Okay, and you will have to teach your family and colleagues at work how to give this injection intramuscularly beforehand. Okay, is everything clear till now? Okay. Okay, so should I proceed further? Okay, so Mr. Zishan, as far as you're concerned about brain damage, let me reassure you that like brief low sugar attacks do not damage brain, but if person become unconscious and low sugar attack is prolonged, only then some brain damage is possible. As you know, like fuel for brain function is glucose only. Okay, 95% is utilized by brain. Okay, so you have to look after these things. Okay, is there anything else you would like to discuss with me today? Okay. No, Mr. Zishan. Actually, Glimepiride is a good medicine to lower increase blood sugar level. Okay, but its dose has to be titrated. In your case, its dose was a little more than your requirement. Maybe at that time you had high sugars. That's the reason the doctor prescribed you. Okay, and so you need not to be worried. Okay, you are in good hands. Okay, and you were in good hands. Okay, is everything clear till now? Okay, so Mr. Zishan, I'll offer you some written material about low sugar attacks to read at home, and here is a leaflet. It includes all the information regarding your condition, and I hope it will be helpful for you. Okay, is everything clear? Should I summarize for you? Okay. Let me summarize. Yeah. So first firstly we talked about your symptoms. Okay, and secondly about your family history, and thirdly about your concerns. Okay, and fourthly we talked about some investigations. Okay, and fifthly we talked about your medicine. Okay, and to change medicine from Glimepiride to metformin. Okay, and lastly we talked about how to deal the emergency situation. Okay, if everything is clear till now? Okay, I wish you a speedy recovery, Mr. Zishan. Take good care of yourself. Bye bye.